There seems to be a significant shift occurring in the field of healthcare in recent years, amidst a growing public perception that the industry is more treatment or symptom-oriented. There are a number of industry leaders with a crystal clear vision towards prevention.
I felt like I was lonely all the time because I felt like everybody was not like me and I was the only one that had all of the issues with me, and that's about it.
If I was lonely, there was a reason for that. If I was depressed, there was a reason for that. I didn't know that it could be something in me that was doing it. You know, I thought it was external.
How do you define courage? Many people recognize true courage as admitting when a mental health issue is too challenging to solve on their own. The individuals who are seeking help from Johnson County Mental Health Center in Johnson County, Kansas, all have that quality of courage. This center understands that mental illness is a disease and that it can be treated so that recovery is real. For over 50 years, they have been reaching out to community members and offer many different services to help address the challenges of mental illness.
We focus on adults that have severe mental illness and children that have severe emotional disturbances. But we're available to any resident of Johnson County if they have any kind of crisis or mental health emergency.
Too many people resist seeking professional help for mental health problems because of the social stigma associated with it. Tragic events, like the recent shootings at Sandy Hook Elementary, create false fears and stereotypes of the mentally ill. They are no more violent than people without mental illness, yet these events unfairly and harmfully label these individuals as inherently dangerous. There can be too much focus on shaming and blaming individuals when the focus should be on providing treatment. The recent Sandy Hook tragedy emphasizes the importance of recognizing symptoms at an early stage to help the individual recover before the illness progresses to an advanced state. President Obama stated that no laws or initiatives can perfectly solve all challenges, but that meaningful remedies may be found by appropriately resourcing the community mental health systems. This would empower them to move beyond their current crisis focus and provide early, effective services and support to people with serious mental illnesses. The Johnson County Mental Health Center is a pioneer in being proactive. Its walk-in clinics offer diagnostic assessments and educational campaigns about the importance of identifying the prodrome of mental illness. The prodrome is an early symptom or set of symptoms that might indicate the start of a disease before it actually occurs.
The more a person knows about their illness, what symptoms to look for, what signs to look for, the more they'll be able to help themselves by accessing our services here at Johnson County.
One of the exciting things we're doing at the Mental Health Center now is mental health first aid training, where we're training non-mental health professionals, other people in the community, to identify, recognize, and intervene early on so that these people can start getting some help.
I had been cutting on myself and hiding it. Really know why I did it, but I knew when I did it I got a relief, so I kept doing it. And getting treatment, I didn't know where to go. I certainly didn't come to Johnson County Mental Health right off the bat because I didn't even know it existed back then.
The Johnson County Mental Health Center strives to treat a wide range of mental illnesses that can affect their community. They offer outpatient services for sexual abuse victims and their families. The center's adult detoxification helps people struggling with alcohol, drugs, or other substance abuse addictions. Their pediatric division provides community-based behavioral health services for youth that is affordable and effective treatment for Kansas teens. To extend their outreach to as much of the community as possible, the center also offers programs available to all deaf persons in Kansas, and for older adults, mental health problems associated with the loss of a loved one and changes in life situations are addressed.
And how often is she coming?
Everyone's unique. Patients are different, families are different, cultures, and different economic statuses create unique problems for us all.
I think working is very good, important thing to do in the life for everybody. Everybody needs to work, to go to work. And every time that I go to work, I look forward to do something better.
Folks that struggle with mental health issues are very consistent and dependable, and that's important for any company that's seeking to put more money on the bottom line.
The Johnson County Mental Health Center is one of the first community mental health centers. It recently celebrated 50 years of service excellence. Patients can go through treatments that include one-on-one individual therapy, group therapy, and family therapy.
I've been through residential where they teach you how to stay with your family, not run, control your anger, control your anxiety, a lot of that kind of stuff.
Tell me what kind of problems you're having.
Too often, access can be a barrier to individuals who should have help. Access is critical for individuals who need mental health care, and the issue often involves funding.
Any Johnson County resident can come in between 9 and 3, Monday through Friday, and have an intake right there on the spot, and either be referred to one of our treatment teams or to one of our community partners.
A recent study showed that 55% of adults with severe psychiatric distress did not receive essential health care because of cost, insurance barriers, a desire to handle the illness alone, or the stigma of being in treatment. It can often be difficult to recognize that one is ill because mental illness is expressed in different ways than a physical illness. People who are affected often don't want to believe they are ill, or they feel ashamed and scared. They don't realize that they are actually experiencing a disease process.
You need to advocate for yourself, and if you can and are able, you need to advocate for others, because some people just can't do that. They don't have the tools, they don't know how to do it, they're too shy.
Here at Johnson County, being in groups with other people like me really helped me to realize that there are people out there like me who need the same help I do.
There is hope for treating mental illness. People do get better. People do function. People are happy again. People can deal with and even have symptoms completely alleviated with some help.
Mental illness is an insidious predator that can be pervasive, disabling, and even life-threatening. It takes unimaginable strength and enormous courage to seek help, recover, and live a normal life while dealing with a mental illness. The Johnson County Mental Health Center is on the leading edge of treating people so that they can escape the silence and shame to achieve recovery and a much brighter future. For more information about the Johnson County Mental Health Center, log on to www.mentalhealthjocogov.org.